This is the application of the Micro Z knee sleeve and the sleeve for the foot. We're actually going to be using the sleeve for the foot over the forefoot and the knee sleeve over the calf. This is an alternative for those people who cannot wear a sock over the foot for hypersensitivity or due to extreme swelling or issues like that. So we're going to be starting, again, this is for one side, so we'll be doing the device, the Micro Z Mini, the knee sleeve and the sock, and then a tube of cream. The Micro Z Mini, you're gonna start by opening the perforated piece on the top to get into the bag. Once you're inside the bag, there's gonna be a black mesh bag with the device, the battery, and the strap. For the meantime, we'll put the strap to the side, and we're gonna start by putting the battery in place. You're gonna wanna get the battery out of the bag first. And you're gonna wanna hold the device in your left hand facing you and or sideways, either towards you or sideways, and you're gonna pull back on the long thin tab at the top, straight back. You are gonna have to put some force on it. It may feel like you're breaking it, but you won't. And then once you get it open, you're gonna put the flat piece to the spring and then close that and put the piece back in place. Do realize it is not a hinge, it is gonna come completely off, so don't feel that you've broken the device. We're gonna now run through how to use it. You're gonna hit the middle button one time, it's gonna say P1 on the screen. P1 is only a 30-minute treatment that is only used for titration purposes, so we are always going to go to P2 by hitting the screen again in the middle on the on active button, and that's going to show P2 on the screen. P2 is a full 8-hour treatment that you'll be sleeping with at night or possibly doing during the day. Please note that you do want to try to do the 8 hours within a 24-hour period. Most patients do this treatment at night, but some do it during the day. Once you're there, you're going to use your right up arrow key and you're going to increase your voltage. For this demonstration, we're going to show 50 volts, which is typical for neuropathy. Once you're on 50 volts, it's going to take approximately a minute for it to start timing out. This timeout mechanism is a safety mechanism so that when you're sleeping at night, should you roll over and accidentally hit a key, you're not going to turn the device off or increase or decrease your voltage. You'll start to see the screen flashing between P250 and 7 hours and 59 minutes. When it starts the countdown from the 8-hour period, that's when it will be locked out for safety. So you'll see that it's starting that now. If you hit the up or down arrow keys, you're gonna see the voltage does not move. Now, if you hit the middle button, it will release the voltage and you'll be able to move the voltage again should you need to bring it back up or down. After another minute, it will lock out again for safety and you will not be able to move the voltage again. That is the device. So we're going to go ahead and turn that off now, and we're going to hold the middle button for about 5 to 8 seconds to shut the device down. Next, we're going to bring the two sleeves out. We have an Electromesh sleeve and we have a knee sleeve by Everyway. At the top are the perforations to open the packages. You'll pull those off and get the sleeves out. So you'll see the smaller sleeve is the Electromesh sleeve. The bigger sleeve is the Everyway sleeve. The Electromesh sleeve is going to be going over the forefoot area and possibly covering the toes if needed. And the other sleeve is going to be going over the calf area. This will incorporate most of the foot except for the very distal aspect of the toes. So we're going to go ahead and take the snap connectors off. You'll see that the knee sleeve has a snap connector that you can pull off because it has a protective piece of leather. On the Electromesh sleeve, that's not there, so you're going to want to put your fingernail between that snap connector and the material and press down so it gently pops off. We're going to put the red wire is going to be for the knee sleeve. That's going to be closest to the heart. So the little snap connector with the pigtail is going to go to the red wire. You're going to want to put that in and cover the silver probe as much as possible. On the Electromesh, the snap connector does not have a pigtail, but it does have a hole at the end of the thin area, and then you're going to slide that onto the end of the black wire. Please ensure that you cover all of the silver as much as possible. All right, next we're going to do application of the sleeves. So first we're going to need to get our cream. We're going to open up the cream, unscrew the top, take the silver seal that's in the way off, and then we're going to put the top back in place. Now you're going to want to go ahead and take off your sock and shoe and pull your pant leg up to your knee. We're going to want to apply the top sleeve first. So we're going to take a nickel size amount of cream and we're going to apply that to just below the knee to about the lower portion of the calf. You want to ensure that you cover front, back, and sides and rub it in thoroughly and cover the entire area where the sleeve is going to be touching. You'll go ahead and put that sleeve on. You're going to want to ensure that you put the snap area down towards the foot so it's closest to the machine as possible so that we're not stretching the wires. Okay. Next, we're going to be putting the sleeve on the foot. You're going to want to put the cream on first. You're going to apply again a nickel size, greater or less, depending on the size of your foot. Go just behind the toes and cover the entire forefoot up to the ankle. Now you can try to incorporate your toes if possible, so that will be just something that you'll be working with the CE on to determine where you're going to be putting it on the foot. In this demonstration, please again ensure that the silver snap is facing up and closest to now the knee so that it can be close to the device when we're putting it together. All right, so from there, we're going to take the black strap that came inside the bag with the device. We're gonna open that all the way up. That strap is gonna go between the sock, between the two sleeves. And you're gonna start with, you're gonna see there's a square end and a rounded end, and one side of the strap has soft, fuzzy Velcro. When you go to put this around the ankle area, just below the sleeve on the calf, you're gonna start with the square end first, the soft side facing out, come back around with the rounded end, overlap that square end, and then stick it to itself. Please ensure that you then move the area where the pocket is to the front so that you're able to put the device in once we have it together. Now you're going to take your device and you're going to put the red lead to the knee sleeve or the larger sleeve. That's the sleeve that goes towards the heart, and the black sleeve is going to go towards the foot onto the smaller sleeve. Once you're there, you're going to turn your device on. By hitting the middle button one time, it'll say P1, but we need to go to P2 for the full 8 hours. So you'll hit it a second time. Once you're there, you're going to increase your voltage to the appropriate voltage set by the clinical educator. It will then take approximately a minute to time out, and then you're going to start tucking it into that pocketed area. So once we start seeing it time out, we're going to unsnap the lead from the top, the red lead, and we'll weave it through from the bottom. So we'll hang on for 1 second to show you that it's going to start timing out. You always want to ensure that it's doing that first because you don't want to accidentally hit a key when you're trying to put that into the strap and accidentally change your voltage. Now that it's flashing back and forth, it is locked out for safety. You can unsnap the red lead. You're going to then weave it from the bottom up through the strap. And then you're going to turn your device sideways so that the wires come out either side. And you want to be careful when you're pulling that wire through not to overstretch it or cause any damage to it. Then once it's in place, you're going to snap that lead back into the top on the longer sleeve. Now that it's in place, you're able to get up and move around, and it is totally portable, and you are now set to go. So now that this is in place, if you do need to use something to secure the area to keep the snaps from coming off, if they're coming unsnapped, you can put a sock over this, or you can cut the foot off of a sock and put the tubing over the area to keep everything in place.